Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, how to prevent serious injuries and deaths on U.S. roadways. Tiffany Joyce Smith is a program advisor at the Vision Zero Network and a lead author of the network's new report entitled Right-Sizing the Role of Traffic Enforcement, Prioritizing Effective, Cost-Efficient, and Equitable Improvements to Road Safety. She joins Dr. Josh Sharfstein to talk about the report, the need to rethink common assumptions about preventing crashes, and the road ahead for traffic safety. Let's listen.
Tiffany Joyce Smith, thank you so much for joining me today on Public Health on Call. How's your day going?
It's going well. Happy to be here. Thanks so much for having me, Josh.
So we're going to talk about road safety, but before we get into the details, could you tell me a little bit about your involvement in the field of road safety?
Yeah, so I'm actually a public health practitioner by training. Originally, I did a lot of years working for a family planning, federally qualified health center. And while I was there, COVID happened. And through that experience, I say to some people, it sort of radicalized me on the need of mobility. Through conversations with patients, a lot of folks were really scared about how they were going to get to the clinic to access their birth control. People were uncertain about taking the subway. Not everybody could walk or bike to their local health center, and sort of kind of seeing all that happen in real time and also simultaneously living in a neighborhood that was directly impacted by safety improvements. There was like a bike lane that was added that directly connected my neighborhood to the north of Brooklyn. So the kind of those things combined kind of made me really interested in mobility and roadway safety. And so I had heard about Vision Zero happening across the country, and I saw Vision Zero Network had an opportunity, and I felt like this was the perfect kind of marriage of my interests. And
Wow.
the rest is history.
So it's sort of like the equation is community health plus pandemic plus biking to work equals switching your career deeper into road safety.
Exactly. And in my mind, I sort of view transportation and public health as really linked. I know like historically they've kind of been separated, but I do really feel like they overlap in so many consequential ways. We know that transportation is a social determinant of health. When you have good mobility, you get easier access to so many critical destinations.
Let me ask you about the overlap between road safety and public health. It starts with the toll of crashes, doesn't it?
Yes. It starts with the toll of crashes. And we also see, specifically in the U.S., amongst other high-income nations, the U.S. ranks last for when it comes to roadway safety. And then when it comes to crashes, and specifically, I would say what kind of differs Vision Zero from kind of general roadway safety approaches is that there's a really explicit emphasis on deaths and serious injuries, as opposed to kind of general crashes altogether, because some crashes may not be life-altering or super fatal. And so we see this emphasis on death and severe injuries, but also similarly to public health, there are observed disparities between certain communities. Some communities are disproportionately exposed to traffic violence, living in conditions where the roadways have been kind of built with high multiple lanes, high speed limits, and not a lot of traffic calming, sidewalks, bikeways to kind of encourage kind of safety in the built environment. And so you see that particularly communities of color, Black communities, low-income communities really experience like a disproportionate toll of deaths and serious injuries.
You've mentioned Vision Zero a couple times.
Yeah.
Tell me what that means.
Yeah, good question. So Vision Zero is a strategy specifically to eliminate deaths and serious injuries while increasing safe, healthy mobility for all people. In contrast to, I guess, like historically how we've done roadway safety work in the US, Vision Zero is really built on the assumption that humans are fallible. They make mistakes. They're imperfect. And so we need to design our transportation and mobility systems in ways that proactively account for those mistakes. How do we design our roadways so that they encourage safety? How do we design our vehicles so they're also minimizing the potential for harm? And what policies are in place to support safety in the built environment?
That does sound like a public health approach. I mean, you take another issue, for example, like diet.
Mm-hmm.
People sometimes focus right in on the individual and they say, how come you're not eating more fruits and vegetables? But a public health lens would, step back and say, can they even buy fruits and vegetables? Are they available in their community? So you're saying, like, don't make it all about the individual when you think about road safety. Obviously people should look both ways before they cross the street, but we've got to do more to make that street safer too.
In the roadway safety space, there's this emphasis on these quote unquote bad apples, these like one-off individuals who maybe make a dangerous decision or drive dangerously when really, and of course that shows up in roadway safety and is a risk, but we need to think sort of collectively about how do we manage speeds all together for everybody, and as opposed to kind of the one-off bad apple.
Yeah, I think about this with the example of kids crossing the street in front of a school. And sometimes I'll ask my students, what would be safer? To put up a sign that says, slow down, 15 miles an hour, to put up 5 signs, to put up a sign that says, you're going to get fined if you go over 15, or to actually put in place some pretty serious speed bumps that slow everybody down. And I think most of the students recognize that it's a lot to trust if they're your kids, just signage, and that those speed bumps could be really important. Would that be an example of kind of a systematic improvement you're talking about?
It's a great example. And I think that's a great way of explaining it, because I think many people on the roadway actually do want to do the right thing and actually think that they are doing the safe thing, but they're also following the kind of natural sort of way that the road tells them to drive. So if you've got 5 wide lanes, but there's a sign or 5 signs telling you slow down, what in the built environment other than the sign is going to like make you slow down? So I think that's a great example.
Okay, which brings us to enforcement, which is the subject of this really interesting report that you have been working on. What is the role of enforcement? Because if you have that individual focus, then you do need the traffic cop right there issuing tickets and teaching people the hard way how to drive safer, be safer on the roads. Talk to me in this Vision Zero framework where enforcement does fit in and maybe doesn't fit in.
Yeah, I think enforcement does have a place in roadway safety, but historically it's kind of been overutilized as a tool. We know that in the Vision Zero approach, we know that we need to design for and account for human error proactively. And enforcement is really just a reactive measure. We know that the data shows that it can be particularly helpful when looking historically at seatbelt usage and impaired driving, but it's still very much so a reactive response. And over-reliance on enforcement sort of overlooks the fact that, there are, of course, individuals that might behave badly on the road, but this is also a systemic level problem. And so if you overemphasize enforcement, you risk sort of overemphasizing individual level solutions for what are really population or systemic level problems that require sort of higher level interventions to be effective. And so while enforcement has a role to play, it really needs to kind of be data informed, sort of look at what are the kind of key fatal issues when it comes to roadway safety, and targeting enforcement in a way that makes sense, is cost effective, and also recognizing sort of the role that, as I mentioned earlier, communities of color, low-income communities are already disproportionately exposed to traffic violence. And so what you'll see is some communities will then target enforcement there, but then there's this double whammy of the potential for harm or violence with enforcement as well, and sort of recognizing that those communities really ultimately as well need infrastructure-based interventions.
Now, does this general approach of focusing on serious injuries and deaths have implications for traffic stops? Are all traffic stops kind of the same?
Amazing question. No, not all traffic stops are the same. Within the enforcement world, we usually sort of refer to there are low-level stops or stops for violations such as, hanging something in your rearview mirror or having a cracked windshield or muffler noise, for instance. Stops for those kinds of infractions, the data shows have no impact on roadway safety. And whereas stops for impaired driving, for dangerous speeding, for reckless driving do have an impact on safety. And what we see is that for a lot of jurisdictions, there's no focused approach on what types of stops they're scaling up. So there's a large portion of stops for low-level infractions that are being done under the guise of roadway safety, but that actually have no bearing on roadway safety. And we see that according to crash data associated with low-level infractions, those are just implicated in just 0.2% of fatal crashes nationwide. So it really is sort of diverting, really, you could say, necessary resources away from enforcing what we know are kind of key issues in the safety data.
Let's talk about some of the obstacles to a more focused and rational use of enforcement. One of them may be the cost of making these environmental improvements. Is that fair to say?
It depends. I mean, we've seen like quick builds can be, which are specifically made with cheaper materials, can be a really successful option for eliciting safe outcomes, but really robust, road designs where you're transforming a 5-lane road to 2-lane road, yeah, it's going to be quite costly.
What about the politics here? Because I understand there's some places that may get revenue from those speeding tickets and may not want to give that up because that may support the town government or something like that. Is that an obstacle?
I guess it depends on the jurisdiction. I would say, yes, it is an obstacle. I would say if the goal of enforcement, whether it's officer-initiated enforcement or this conversation around revenue generation also comes up with automated enforcement, speed cameras, red light cameras, etc. If the goal is ultimately to improve safety outcomes, the revenue, there shouldn't be a goal of generating revenue. And then that kind of creates this sort of conflict of interest where you're sort of relying on kind of catching people or trapping people to kind of fund your governmental operations. So I would say it is a challenge, and there have been cases of this. I think of like Ferguson off the top of my head is one sort of big example. There was an investigation that showed that there was this over-reliance on revenue generation, but that revenue can also be kind of reinvested back into the built environment, into the infrastructure. So it's not as if that money can't be redirected elsewhere or even rethought of or reimagined, because we also have to think about like low-income folks. Like if you have this system that's set up to kind of encourage trapping people, who really ultimately bears the brunt of that is the low-income folk because they have to pay the ticket. If you're someone who can automatically afford $100 ticket,
Right.
What incentive is there to change your behavior?
So interesting. So tell me about some examples, perhaps, where enforcement has changed because the environment has changed and it's particularly helped a disadvantaged community.
I would say there's some really interesting examples coming out of San Francisco. They actually did some comparisons. They did a high visibility enforcement and campaign and did see some reduction in speed. But what they found that as soon as the officer presence was removed, people immediately went back to kind of the same speeds that they were driving before. And so after installing both, traffic calming interventions as well as speed safety cameras specifically, they observed significant reduction in speeds and fatalities on the corridors where they implemented these safety protections. And sort of ultimately the data showed that, investment in these safety outcomes, the investment in these safety interventions ended up kind of outlasting this high visibility enforcement campaign. So that's like one example that comes up at the top of my head. But also New York has kind of been really focusing on the built environment, looking at the revenue that they generate and making sure that that goes also back into the built environment for safety projects. Philadelphia, similarly, has been really focusing on managing speeds and investing in traffic calming in supplement with speed safety cameras specifically.
Got it. And you say traffic calming, and I do have a couple images there, but what are specific techniques that a community could use to slow down traffic?
Yeah, it's a range of things. You can do like these sort of pedestrian refuge islands. It can also be traffic calming is sort of like a blanket term. So it can also be just physically narrowing the roadway. It can also be adding in sidewalks and bikeways because that also narrows the roadway. Also heard of communities using sort of street side parking as a form of traffic calming. It can also be medians and sort of how you place them. Speed humps or speed tables, depending on how you know them as. Really, it's just a range of sort of infrastructure devices that you can place in a roadway or arterial road that encourages people to slow down or stop. But traffic calming can also include things such as like signal timing, which ultimately kind of encourages folks to maintain a certain speed because they can then hit this green wave of lights. So if you time the signals properly, it can actually incentivize folks to go slower.
There's a whole world out there.
Yes, exactly.
And it seems to me what you're saying is that there are these things that we can do that make all of us safer, not just the speedy drivers, but the people that they might hit, that just naturally make our environment safer for transit without having to rely on enforcement that may not actually be doing all that much.
Exactly. And I would say too, people, everyday people using the roads, but even particularly people moving outside of vehicles. As vehicles get bigger and heavier, that creates increased risk for people walking and biking. And so traffic calming is a really great proactive measure at protecting these particularly vulnerable road users as well.
What I like the most is the fact that you're really calling for a reorientation of the whole traffic discussion around serious injuries and deaths. And when you start there, it leads you naturally to these public health solutions.
Exactly. Yes. I would say that. And to your earlier point about this sort of being like a public health approach, I mean, in my mind, it is. I say to people, it is, because it really is looking upstream, looking at all of the factors at a higher level and what, like both individual level, interpersonal, sort of social, political, like what are the different ways you can integrate safety at all levels so that we can all move safely to and from our communities.
Well, that's so well said. I'm so glad that there is a true public health person working in this really important field for all of us. Thanks so much for joining me on Public Health on Call.
Thanks so much, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.